everyone, this is Dr. Palvi again from Physiologic in New York City. In the last episode, I talked about what involves back pain and how back pain is evaluated. Today, I want to talk to you a little bit more detail about generators of back pain, and that requires a good understanding of the anatomy. So today, I'd like to talk to you the details about what the spine has and where the pain generators can begin. So next to me, you're seeing here a model of the spine. This is actually the lower part of the thoracic spine and the lumbar spine. Lumbar means the lowest part. So this is the general anatomy right here. I want to review that with you. You're looking at the spine here from the side. And how do you know that? Well, these are the little bones in the back of the spine right here. And those are the same bones that you can feel if you reach around. And these are called your spinous processes. But there's actually obviously much more to that. The spine is basically composed of vertebrae that are stacked on top of each other. That's each segment here. Each one is given a number, which I'll talk about in a second. So therefore, this is the front, this is the back, this is the tailbone down here. The tailbone is actually a fusion of vertebrae, and so it's actually one single bone, and that's called the sacrum. Each bone here is given a number, and we're just going to focus on these 5 right here. And basically each one is given a number, typically L1, L2, L3, L4, L5. The sacrum is called S, and because there's only one, that level is referred to as S1. And so basically what you're dealing with here is a lateral view of the spine. Couple of things I want to explain to you. First of all, let's start with the yellow structure here. This is your spinal cord. The spinal cord, of course, is basically, I like to refer to it as the computer of the body. It is responsible for all of your musculoskeletal functions, at least, amongst other things, neurological functions, specifically movement, the ability to feel, the ability to detect pain, vibration, proprioception, temperature, all these different things basically are computed by the spine and then sent to the brain. So the spine is a very important structure, and therefore this spinal column here is designed to protect that structure. The spine gives rise to the spinal nerves. They're truncated in this model, but they actually run all the way from your back down into your toes. The other thing couple of things I want to draw your attention to, the blue structures here, these are called your discs, intervertebral discs, meaning they separate the levels of the vertebrae. Discs, they're soft, they're like jelly donuts almost. They're tough on the outside and very soft on the inside. But these provide cushioning for these vertebrae as well as support for the spine. Here in the back, these are your joints. Joints are basically where 2 bones hinge on each other, okay? So you can see the movement of the spine occurs at these hinging points. Any place 2 bones hinge on each other, that's called a joint. Just like your knee joint is where your leg hinges on your thigh. Similarly, these are tiny little joints in the back. And these joints in the back are also called facets, F-A-C-E-T-S, facets. And these structures also can be problematic. So what specific structures here can cause back pain? There's a plethora of them. There's at least 15 that pop in my head right away. But I want to talk about some of the major ones. Let's start with the discs. A lot of people have heard of discs. Discs can slip. So what does that mean? It's basically, if right now you have this kind of nice straight, it's curved, but it's all in one line. But if a disc slips out of place, it ends up putting pressure on the nerve, which is right behind it. And as I told you, this nerve can travel all the way down your leg. So you can have, once that disc is putting enough pressure on that nerve, not only do you get inflammation in that area, but you also get irritation of the nerve itself, and that presents as certain symptoms. Typically, it can be pain, but it can also be tingling type sensations, or if it's severe, you can have numbness or even difficulty with movement. So those are some of the things that your doctor is probably evaluating for when you're undergoing your physical exam. Other things that can cause pain, the joints in the back, they can become arthritic. Arthritic simply just means degeneration, or actually it's Latin for arth, which is joint, itis is inflammation, so it's just inflammation of the joint. It's not necessarily that the body has decomposed or it's a end-stage degenerative process. Arthritis just means that the joints are wearing out, or they're inflamed, or they're both. Either way, those can also cause pain. Sometimes you can have a fracture if the front part here is called the vertebral body. Sometimes if you have weaker bones and if you have a trauma, then you can fracture that bone. Commonly, that's called a compression fracture. The other condition I want to describe to you is sacroiliac pain. A lot of people use that word, and what does that mean? So actually, it's not pictured here, but as I told you, or it's not, you can't appreciate it at this angle, but this bone right here, as I told you, is the sacral bone or the sacrum. So if you turn it this way like so, now you're basically looking at this model right here. So now this is that spine from the front, and that's that sacral bone right there. This is actually the pelvic bone. These are the ones that you feel we sometimes refer to them as hips, but these are actually your pelvic bones. And that big bone right there is called the ilium. So where the ilium articulates or basically interfaces with that sacral bone is called your sacroiliac joint. And basically in that joint, you can see some inflammation or degenerative type changes, which can also cause a different type of back pain. So basically, in summary, these are 4 different conditions that I've explained to you that are common, but these are some of the things that you may be evaluated for when you're seeing your physician. So that's it for this one, guys. If you have any questions, please feel free to send us a message or drop a comment below. I'll see you in the next one. Thank you.